If you believe advocating for your health is important, but not always easy, you're going to love Speak Up for Your Health, hosted by Dr. Arkell Giorgio. On Speak Up for Your Health, Dr. Giorgio talks with patients about how they overcame feeling intimidated by today's complex medical system and how they use their voices to finally get the care they need. You'll hear real and personal stories like Marielle's 11-year journey to diagnose a medical mystery. Why navigate the complexities of healthcare alone when Speak Up for Your Health can guide you? Listen and follow Speak Up for Your Health on your favorite podcast app, and you can find all the links you need at healthpodcastnetwork.com/speakup. That's healthpodcastnetwork.com/speakup.
And if you interviewed nurses today, I think you would get very different answers to what it was like then. We were in the room for a CEA takedown for, I think that dressing was 8 or 10 hours, right? And we're not seeing that kind of length of a dressing takedown anymore either. With the new skin substitutes, we are able to cut down on the dressing change time as well. And that also lessens moral distress.
Burns ranks 6th among the 10 top preventable injury-related deaths in the United States. And for those nurses interested in a fascinating career path, there's a respected and rigorous certification process and a plethora of career possibilities. Let's talk all about the specialty of burn nursing with Johns Hopkins Burn Center Patient Care and Burn Program Manager, Dr. Emily Werthman, right here on episode 507 of The Nurse Keith Show. Hey there, this is Nurse Keith. This podcast is all about you, your personal professional development, your career, and the healthcare system writ large. And I'm here to share education, ideas, and informative interviews with some of the most inspiring people from the world of healthcare, nursing, entrepreneurship, and beyond. If you'd like to help other people find the show, consider leaving a rating and review over on Apple Podcasts. That is more helpful than you can possibly imagine. If you'd like to become a patron, head over to patreon.com, patreon.com/Nurse Keith if you would like to contribute just a teeny tiny bit every month to help keep the show on the air. And you can also share the show with anyone who you think might enjoy it or get something out of it. I really appreciate those shares. And no matter how you're interacting with us, thank you for being here and thanks for listening. Please head over to nursekeith.com to find the show notes for this episode. And the show notes are always in any app where you happen to find yourself listening on your smartphone or any other device. As I said, we're here today with Dr. Emily Werthman. She is the Johns Hopkins Burn Center Patient Care and Burn Program Manager. And Emily, it's so great to have you here. I'm so glad we've had a chance to chat before this. And I wanted to just start asking this particular question. How long has this specialty of burn nursing actually existed?
So that's a great question. The specialty of burn nursing in terms of credentialing is a brand new credential. We started in October of 2023, but the specialty itself has been around since ancient times, right? We have kind of our first recorded history of burn care and burn nursing in ancient Greece and Rome. And the ancient Egyptians actually wrote some texts about using honey on burns, and they already knew about its antimicrobial properties then, right? So burn care and burn nursing have been going on since really the beginning of time because fires have been around since then, right? But in terms of our specialty designation, that is very new with the advent of the certified burn nurse exam through BCEN.
Oh, interesting. Well, thanks for bringing in the historical context. And that's right. I mean, ever since the discovery of fire, there have been burn injuries and somebody had to care for them, right? So
yeah, and there's some really fascinating historical texts about burn nursing. If anyone is a history nerd like myself, some really great reads in terms of what we used to do for burns. And it's interesting to see how much things have changed and sometimes how much they've stayed the same.
Yeah. So since you brought up that the certification is new, let's just go into that and just talk all about the certification. So when you say that it's only been in existence like truly since 2023,
right?
So before 2023, there was no certification process for those who wanted to specialize or were specialized in burns.
Correct. So, Gretchen Carrower, who is out of the University of Washington, out in Seattle, started advocating for certification in burn nursing, I believe, in the 1970s or 80s. She's going to be mad at me if I got that wrong, but it's been a long time that she's been advocating for that,
Okay.
as well as Katie Holloway and lots of kind of pioneers in burn nursing certification and the advocacy for that. It really came to a head maybe 5 or 6 years, maybe even longer ago than that, when we started saying, well, if we want to have a certification exam, the first thing we need to do is have burn nursing designated as a specialty area. So we went to the ANA, partnered with them, and we're very lucky to have the advocacy of a former burn nurse who was at that time the president of the ANA, partner with us to make sure that we could get that accomplished. And once we got the designation as a specialty, then partnered the ABA burn nursing experts with BCEN experts in credentialing and testing, partnered together to come up with the first CBRN exam. I was involved in that along with Katie and Kathy, who I just mentioned, and some other great nurses who work in burn care, to do the first role delineation study, where we looked at kind of what does a burn nurse do? What should we test on to make sure that this is truly what a burn nurse does? And then once the role delineation study was done, then we started working on item writing, which I was also really excited to be a part of. As I just mentioned, I'm a huge history nerd. And so to be part of that historical act of writing the first CBRN exam was so exciting for me and for all of us who worked on that. And then we had the first burn nursing exam in October 2023. And since that time, we've already had 500 nurses become certified burn nurses, and are looking to get our magnet or accreditation this year so that it counts for your magnet applications at hospitals that count their certified nurses for magnet accreditation.
Well, that's exciting. And
very exciting.
yeah, and I understand. So you go to the ANA first because you have to get their partnership and you have to have that recognized. And
right.
Who was the president at the time at the
Ernest
ANA?
Grant, who is from UNC, from the Burns. Yeah. And so I know that he is a consummate professional and burn nurse, and really helped shepherd through that process, I believe. Yeah.
Oh, that's awesome. He was on this show back when he was president
he's great.
of the ANA. Yeah, he's a great guy.
Yeah.
So, and then you partnered, you said BCEN, which is the Board of Certification for Emergency Nursing.
Right.
And so even though burns aren't necessarily, well, they're an emergency in an emergent situation, but then they become something that's not done in the emergency room. It's actually done on a burn unit.
Right.
So partnering with the BCEN seemed like the best way to shepherd this through the process.
Absolutely. Yeah. So it was really a fortuitous meeting between some members of the ABA and some staff members who worked at BCN, who mentioned to the BCN staff members, hey, the ABA is really looking at this. The ABA being the American Burn Association, sorry. The American Burn Association is really looking at a certification for the nurses. The nurses have really verbalized that this is a need for them to distinguish themselves as professionals. And, we don't know kind of what the next steps are. And the folks at BCN said, we do. We know exactly what to do next because we've done this before. And I like to remind people when I talk to trauma nurses a lot and at trauma conferences, and what I'll tell them is, because they have the same sort of questions. Well, burns are, they're in the emergency room for a very short period of time, right? But the truth of the matter is that almost all burns are a trauma. So what I tell people is not all traumas are burn, but all burns are trauma. And so when you think about it from that perspective, because no one, even an accidental burn, usually has some sort of traumatic mechanism involved. Either it's a motor vehicle crash or, you jump over a fire pit and then you also break your ankle as a result. There's a lot of trauma involved in burns. So it really made sense for us to partner with people who do trauma and emergency nursing.
Mm-hmm. Wow, fascinating. So you've been a burn nurse for 14 years, right?
Yes.
And you teach in Baltimore.
I do.
When you talk to people about burn nursing, let's just say when you talk to other nurses about burn nursing, and those of us who have not encountered burns, except maybe when we burned ourselves, at a campfire or something. So when you talk to people about burn nursing, what are the myths that maybe still exist about the treatment of burns? Because I probably believe some of those myths myself. So I'd love to dispel some of them right now.
Yeah. I love that question. And I love talking to people about the common misconceptions of burn, because I do think that One of the common misconceptions with burn is, I call it kind of the Grey's Anatomy myth, right? And I think this is true in many specialties where people who are new to nursing, and I talk to people who are pre-licensure and lecture in nursing schools, and they think that healthcare is really what they see on television. They think it's what they see on Grey's Anatomy or these other shows, right? And so they think that burn nursing in particular is done by plastic surgeons, and the nurses don't really have much to do in terms of the care of the burn patient. And what I will say is that one of the many reasons why I love burn nursing is because there is no other specialty, in my opinion, that allows the nurse to create the same kind of relationship with the patient that you can do in burn nursing. We spend hours and hours a day at the patient bedside because, contrary to Grey's Anatomy, nurses do the wound care in a burn center. And that's true at the Johns Hopkins Burn Center. And that's true at Seattle Harborview. That's true at MUSC. That's true at any burn center you're going to go to. Nurses are doing the wound care. And so that means that we are with our patients for hours a day. So we create a really unique bond with them. Most burn centers, including the Johns Hopkins Burn Center, where I am, also hold on to our patients forever. So when they are ICU and they're critical care and we're doing a 6-hour dressing change and they're on CVVH and we're titrating pressors and they're on an insulin drip and tube feeds, they're very complex critical care patients. We still also have them when they are floor status and they're getting ready to be discharged to a SNF or to a rehab facility of some kind. So we get to see that recovery, which is so rewarding. And the best part of being a burn nurse is that once you're a burn patient, unfortunately, you do have a lot of reconstructive needs throughout the years of your life. So even once you're discharged from the hospital, you will then come back for your reconstruction for years later down the road. And while that's unfortunate, it also is another chance for us to continue caring for these patients that we cared for. These 90% burns, we still take care of them 10, 15 years later doing contractures. And so we still get to check in with our patients and their families and see their marriages and their kids and their divorces sometimes, their graduation from college or high school or whatever it is. And so we really become a part of each other's lives, which is such a special part of being a burn nurse and one of the biggest rewards, I think.
Oh, well, thanks for characterizing that. And I'm just curious, maybe one of the myths is like that as a burn nurse, you're going to cause your patient incredible pain. They're going to absolutely hate you and they're going to cringe and pull away from you every time you walk in the room. Right.
Yeah.
And that's probably from like movies and TV and all those sorts of things. And maybe I'm sure it's not a comfortable process when you're doing a 6-hour dressing change on a 90%, full thickness burn. Mm-hmm. But so what is it like for the patient and what's it like for the nurse when you do have an extensive burn and you are taking off their dressings and reapplying them over a 6-hour period? What's it like for both partners?
So that has changed a lot. I will tell you that when I first started burn nursing, we used the same opioids that everyone's familiar with from critical care. We used Dilaudid and morphine and fentanyl to a certain degree, Versed, which was really helpful. But the pain was really still an issue for both parties, right? Because as nurses, we become nurses to care for people. The heart of what we do is caring, right? And so to go in and think about causing excruciating pain to someone for a number of hours it causes a lot of moral distress in a nurse and burnout, right? Mm-hmm. One of the things that we have gotten so good at is, I don't want to say pain control because it's not control, pain management. So with the advent of using ketamine and conscious sedation and moderate sedation and those things, we can really help people manage their pain in a much more effective way than we were when I first started doing this 14 years ago. And that is not only better for the patient because we know that uncontrolled pain is an independent predictor of PTSD and of acute stress response as well, but it also really predicts burn nurse burnout and burn nurse moral distress. We don't go into this business to torture people. And so I do think that there is sort of this misconception that if you are a burn nurse, you're working in a torture chamber for 12 hours a day. And that is truly not the case anymore. Certainly there is pain involved, as there is in almost any area of critical care. But I do think that we have made huge leaps and bounds in terms of our pain management strategies. I'll also say with the advent of new skin substitute products. Our grafting techniques have changed significantly over the years, and that causes a lot less pains because we're not having to do dressing changes quite as frequently. We're not having to have donor sites where we take the skin to graft as large anymore, and the donor site pain was pretty intense for a lot of people. So pain management has really been a huge benefit to advancing our practice.
That's very good to hear. So that must change the trauma for the patient, obviously, but I think it also sounds like it changes the level of trauma for the nurse, because you don't want to be the person who's causing pain. You don't want to be feared, right?
Yeah. We published an article about 10 years ago. It was written by Dr. Stephen Milner about, it was really a case study about taking care of a patient with CEA, which is cultured epithelial autograft, which is where we grow the patient's own skin in the lab and then put it back on them. It's very cool, very Star Trek. And he interviewed nurses about what's the experience like. And if you interviewed nurses today, I think you would get very different answers to what it was like then. We were in the room for a CEA takedown for, I think that dressing was 8 or 10 hours, right? And we're not seeing that kind of length of a dressing takedown anymore either. With the new skin substitutes, we are able to cut down on the dressing change time as well. And that also lessens moral distress.
So you're actually growing patients' own skin in the lab and then applying it.
Yeah, it's very cool.
That is pretty remarkable. That is,
and
amazing.
That's not new technology. That's been around for a couple of decades now. But when we explain it to patients and their families, it is. And we really reserve that for very large burn cases, obviously. But it's a really fantastic technology and really life-saving.
That's really wonderful. So tell me, we've mentioned the word trauma several times, right?
Mm-hmm.
And there's trauma all around. I mean, there's no getting around it. And we'll talk about the types of burns in the second half of the episode. But I wanted to ask about trauma-informed care, like where, that's become a thing. Like it's something that we talk about in medicine and nursing now. It's everyone's not everyone, but most people are used to hearing that term now. So where does that notion of trauma-informed care come into burn nursing? Because it must be an enormous part of what burn nurses have to take into consideration.
An enormous part of what we do. I think that our perspective here at the Johns Hopkins Burn Center, where we operate in the city of Baltimore, which has unique challenges and areas for improvement in terms of our public health initiatives. We have a lot of gun violence, a lot of substance use disorder. And so a lot of our patients have grown up in really horrific circumstances. And as I mentioned, one of the benefits of spending all this time together with patients is that they at some point start to open up to you about, even if it's unintentional, about, I used to eat Pop-Tarts all the time because we only got to buy groceries once a month and my mom wasn't there and my dad wasn't there and that sort of thing. And so you kind of become engrossed in their world. My research specifically focuses on adverse childhood events, or ACEs. And so what we have found in our population here in Baltimore is that almost 100% of our patients have some sort of adversity in childhood. And so that's really important for us to understand that and realize that changes so much about the way that we have to perform care and how we have to partner with that patient. It changes brain chemistry, it changes the way pain medications are metabolized, it changes the way we interact with each other. And if you don't have that kind of background understanding about those changes that happen as a result of trauma, you can't respond in a way that's going to be therapeutic for the patient or for you as the nurse, because it's going to impact your ability to create that therapeutic relationship with your nurse and your patient. So it's really important for us to think about trauma-informed care. And we sort of operate under the assumption that the day we meet someone as a burn patient is the worst day of their life, right? No one comes to the burn center for fun. And so we recognize that the day we meet them is just a normal Tuesday for us, but for them, it's the worst day of their life and the worst day of their family's life. And that colors a lot of what we do in terms of our care. So that means we take our time. So a dressing change that takes 4 hours maybe could be done in 45 minutes, honestly. But if you rip a dressing off somebody who's been physically abused in their childhood, you're re-traumatizing them. And so we have to take our time. We have to explain things very calmly and coolly, and think about our word choice, right? If we talk about trauma with someone who doesn't recognize what they went through as a trauma, they're not going to understand what we're saying. We have to use the right words and we have to use the right tone. It's also things like warm blankets, right? Because some people who've been through trauma, touch can be really triggering, right? But a warm blanket is very rarely triggering, right? So sometimes we can't give somebody a hug, but we can give them a warm blanket, which feels like a hug. And so it's really important to think about those small things that make, the world of difference for our patients.
Wow, what a multifaceted specialty. I had a very vague understanding of it before, so I'm glad to get this insight into what it's truly like for both the patient and the nurse. So when we come back, I definitely want to talk about the certification process, because that's such an exciting development, and the accreditation that's on its way, hopefully this sometime in 2025. And I also want to talk about types of burns, because there are a lot of types of burns, some that we might not even think about, that you mentioned to me in our previous chat that you and I had. So when we come back, we'll be talking again with Emily Werthman. She's the burn program coordinator and interim patient care manager of the Johns Hopkins Burn Center. So we'll be right back with the second half of episode 507 of the Nurse Keith Show. Are you looking for a fascinating and novel way to empower and elevate your career? My wife, Shada McKenzie, is a gifted traditional astrologer and reader of the tarot with clients around the world, and she offers my listeners a 10% discount on their first consultation. Shada's approach to astrology emphasizes the integration of both modern and traditional techniques as they've been practiced for over 2,000 years, and she brings her sensitivity, life experience, and wisdom to every consult. Shada's work can reveal deep-seated patterns and unlock your potential to live a more meaningful personal and professional life. I and many of my clients have benefited greatly from Shada's mastery of these ancient tools, and if astrology is aligned with your personal belief system, I encourage you to consider reaching out to her at thecircleandthedot.com or email her at Shada, S-H-A-D-A, at thecircleandthedot.com. Remember to mention the Nurse Keith Show for 10% off your first consultation, and thank you. And welcome back to the second half of the episode. We're here again with friend of the pod and my new friend and colleague, Dr. Emily Werthman. She is the Johns Hopkins Burn Center Patient Care and Burn Program Manager. And Emily, I wanted to ask you first, how did you first enter the world of burn nursing, and why was it of interest to you? What was the big attraction for you to take this on?
Yeah. So, my coming to burn nursing unfortunately came through kind of personal tragedy, in that I had recently graduated from college with a degree in history and was working in a nonprofit doing some grant writing, and got a call on a Saturday morning that my mother had been fatally injured in a house fire in her home in North Carolina. And through the process of kind of that survivor's guilt and grief and all of the things that come along with losing a parent, especially in a unexpected way, I started thinking about how I had not been with my mom when she died. She'd been alone, right? And started thinking about, that was, a horrible realization to think as a child that your parent has died alone because you weren't there. And it came to me, I can't remember how at this point, but I think someone told me, well, she wasn't alone because the nurses were there. And I realized that she had gone to, she was in North Carolina and gone to a burn center, and the nurses there, I know this now because I'm a burn nurse and someone explained it to me then, would not have let her die alone. And I sort of thought, I was sort of unfulfilled in my grant writing job. It was fine. It wasn't anything great. It wasn't anything terrible. And I sort of thought that would be an incredible gift to give to people, an incredible legacy for my mom, if I could do that for somebody else someday. And if I could be that person for someone else to know that their mom hadn't died alone or their dad hadn't died alone. And a lot of people really discouraged me from that. And we're like, this is going to be too personal. This is going to be horrible for you. I don't think you're going to like this. And my educator here was like, the first time you have somebody's mom die and you have to tell them that their mom has died, like, are you going to be able to handle that? And I thought to myself, I don't know if I can. So I got to try it and see. And obviously it turned out great for me and has been professionally and personally so fulfilling. I love what I do so much. And I know you have asked and other people have asked, is it okay if I ask about your mom? And I always say, I love talking about my mom. She was an amazing person. And I'm so glad that out of the tragedy of her death, I have gotten to help so many other people. And I get to still keep talking about her in a way that is really meaningful, not just to me, but hopefully to other people who are thinking about a career in nursing. And I think there's always an opportunity to make meaning out of a horrible tragedy.
Wow. Well, thank you for sharing that. I greatly appreciate it. You mentioned it in a wonderful YouTube video about the specialty of burn nursing, and that's linked in the show notes so people can see you and hear you in that excellent video by BCAN. And, so your mom died in a house fire. And I think when we think of burn injuries, house fires seems like could be a fairly common thing. I'm sure firefighters get injured. They get burned all the time, I'm sure, just because of the nature of that incredibly dangerous job that firefighters do. And I'm sure people get burned in the military in many, many different ways, right? People serving in any of the branches of the military.
Yes.
But there's a lot of other types of burns. So before we talk more about the certification, I just want to kind of run through, because there's some that you mentioned to me in our previous chat that I would never have thought of. So can you tell us about some of the kind of common and then some of the more uncommon ones that we wouldn't necessarily think about?
Yeah. So the big one, and I can't remember now if we talked about this previously or not, the big one that's recently come up are these kind of indoor s'mores kits. There's just an alert that came out in the last month, actually. So this is very hot off the presses. It's sort of an indoor tabletop fireplace. It's kind of got a sterno component, and then you can. The idea is you roast marshmallows over it and make s'mores indoors. I like to tell people, unless it's in a fireplace, you shouldn't be burning it indoors, right? And so we've seen a huge number of injuries, including house fires, including fatalities, and some really significant burn injuries from these little tabletop s'mores maker kits. And so the consumer protection agencies have actually issued a recall and said they're coming out, and the American Burn Association has issued some warnings about it as well. They're incredibly dangerous. So I would encourage anyone who's listening who got one for Christmas or thinking about getting one to please get rid of it safely, because they are incredibly dangerous. The other thing that we do see a fair number of kind of social media challenge burns. So there was the salt ice burn a couple of years ago that we saw a couple of those. There were some people who would try to give themselves sun tattoos by putting, I think it was lemon juice, and then laying out in the sun, and they would get a little burn from that. We see a fair number of burns from vapes, where the battery will explode in a pants pocket or a shirt pocket, and then that article of clothing will also ignite. Vapes are, and they cause some pretty serious burns, especially if they're sitting next to the skin, which they usually are because they're in a pocket. So they can cause a full thickness burn, some of these batteries. And we see a fair number of, with little kids, we'll see a lot of scald injuries, right? Because kids will always, mom's got a cup of coffee on the counter and kid looks at it and pulls it down on their face, right? But with adults, we see a fair number of workplace related injuries in terms of chemicals. Glass etching chemicals in particular can cause a lot of injuries. We'll occasionally see tar injuries from roofers, where the tar gets stuck to their hands. And there's a special way that we have to remove that. And then, of course, there's the people always ask during COVID, did you guys slow down? And I say no, because everybody moved their activities outdoors during COVID, right? And how many people do you know who had a fire pit outdoors during COVID? I mean, it feels like everybody I knew did. And fire pits and alcohol are typically not a good mix, and somebody will invariably say, "I bet I could jump over that fire pit after I've had a couple of drinks." And next thing you know, they've got some burns on their feet, or they've unfortunately fallen into a fire pit. So we see a lot of the fire pit injuries as well. And then in the summertime, we'll see a lot of kind of boat explosion injuries. People working on their boats and the engine will explode. And unfortunately, sometimes if they're below deck, so to speak, they'll get some inhalation of those noxious fumes as well. So lots of different mechanisms. Yeah.
So much. And when you and I chatted earlier, you mentioned TikTok challenges like the
Yeah.
lighting hairspray with
Yeah.
a lighter. You also mentioned
Yeah.
something about frostbite from hands in ice water.
Right. So there's another TikTok challenge where people are trying to keep their hand in ice water for as long as possible. And so they can either get frost nip or frostbite from that. The TikTok challenges are, they're not challenges. They're just very dangerous.
Mm-hmm.
I wish that people would stop doing them. And we also see some kind of, we'll see occasionally frostbite from people utilizing duster, like the keyboard dusters. You can huff that as it's a substance use disorder. And so they will huff the duster and then it'll get very, very cold and they'll unfortunately pass out after inhaling it. And then that cold can will be on their nose. And so they'll end up with kind of frostbite of the nares from that. So we see frostbites from all kinds of things.
That's all just highly disturbing.
Yeah.
And I know people can get radiation burns when they're undergoing cancer treatment.
From cancer.
And then you also mentioned to me meth lab explosions, suicide attempts, drunk driving. There's a lot of different ways in which people will come in contact with some kind of burning substance of one kind or another.
Yeah, it's certainly not just the house fire that I think a lot of us think, oh, there's a structure fire of some kind, but really, especially in our area and more rural areas, I don't know, but I know that from our data, and we look at kind of the mechanism, we have a very mixed mechanism of injury here. But unfortunately, again, because we do have some unique challenges here in Baltimore, we do see a lot of burns related to substance use disorder. So as you mentioned, the meth lab or people who are using illegal substances in abandoned houses, and then the house catches on fire. And we see a lot of that here in the city, especially in the colder months.
Yeah. So when we think about substance abuse, we think about, people's aberrant behavior, most likely due to a traumatic background. And we're talking about trauma-informed care. So when we do have substance use disorder, when we do have these sorts of, like a meth lab accident, how do burn nurses approach these types of patients? And how do you help burn nurses deal with judgment? Because judgments are going to come up. Like, why was there a meth lab in your house? So how do you put that aside and just see the person's humanity? Are there things that you teach? Is part of the certification process dealing with the sort of like psychosocial, et cetera, issues that are obviously part of a lot of burn injuries?
I think part of it definitely is part of the certification. And when we talked about our kind of role delineation study, we had a very long conversation about how much of this test can we really test on the unique ethical and kind of really just ethical concerns that are involved in burn nursing, because this is what we see day in and day out. And we do have a fair number. We really decided that needs to be a good bit of what we're talking about, because this is a unique to the burn specialty. And this is not something that I only see in Baltimore. This is something that my colleagues see across the country, right? Especially in terms of kind of the patients who have attempted suicide with a burn injury. There's a lot of sometimes judgment that can go with that as well. I think that nurses in general do a pretty good job of understanding that we treat the patient, not the disease. Burn nursing in particular is incredibly holistic. And I'm incredibly proud to work with a team of nurses here who are so fantastic at understanding this person's actions are part of a disease process. And what I tell nurses and what I tell I have young kids, I tell them this, I'm trying to create another generation of people who are non-judgmental, right? And I tell them this all the time. Do you think anyone, when they're 7 or 8 years old, says, when I grow up, I want to be a drug addict? No one says that. The unique set of circumstances that have led someone to have a substance use disorder, whether they be genetic or environmental or a combination thereof, are not something that most people can understand truly what has led them to that. And so I think having an understanding of that is really important. We do a really good job here of understanding that. I'm really proud of the team that we have here. I will also say that involving social workers, I mean, I personally think that if we had like 10 million more social workers on earth, we would all be in a better place. I think they are angels sent to us from heaven. I don't know what we did to deserve social workers. They are a huge benefit to kind of helping navigate these complex relationships with patients where we see, you know, there was some sort of responsibility in terms of how you got injured. And that's hard as a person to separate from that. And our social worker helps with that a lot. We have a unit psychologist who also helps with that a lot. But I think that's really the essence of nursing, is being able to treat the person as a whole person and understanding their whole history, if you can, and making your best effort to impact them on a personal level as well as the professional one.
Well said. Thank you. Thanks. I love how you pulled all that together. Thank you. So in terms of the certification, so it's only been in existence since 2023 in terms of being approved by the ANA, and then the accreditation is coming in terms of magnet.
Very soon.
And what does that mean? Like when it's magnet accredited, what does that mean for a hospital in terms of their burn nurses?
So basically, the way the exam works and the way the certification works is we have to have a certain amount of data in order to say, look at this test, and here's all this great data to show you that we need to certify this test. My hospital right now is on the magnet journey. That's what we call it. We're getting ready to apply for magnet. And so what that means, and other magnet hospitals will recognize this, I'm sure, is that you have to provide in your magnet application how many nurses are certified. And they don't just mean any certification that you buy from Joe Schmo on the internet. They mean a certified valid and reliable certification that proves these nurses are experts at what they do. And so having the certification for the CBRN exam will mean that you can use that in your magnet application to say, oh, look, my hospital has 10 CBRN. And so that is 10 more certified nurses that we can put on our magnet application. And magnet has a huge emphasis on certification. So we're really excited to get the exam certified here soon and get all that stuff included in the magnet application.
That's really exciting.
Yeah.
And I'm sure the nurses are excited about it too, of course, because there's recognition. You get those initials after your name. I mean, there's a lot of great things about being certified.
Usually advancement in terms of salary as well, and advancement up the clinical ladder. So it's really important for nurses to be able to say, this is what I do and this is who I am and this is my professional designation. Yeah.
Yeah. And career mobility, all those sorts of things.
Yeah.
So I'm assuming the exam is very rigorous, right?
Yes.
Yeah.
Yeah. I have nurses here who I've worked with for 10 or 15 years who are like, do I need to study for this? And I'm, yes, you do really need to study for this, especially the BCN does such a great job with transparency in terms of the outline of the exam. And the ABA has some great review materials now available. And I would encourage people to form little study groups. I love the idea of a study group across burn centers because we are a small specialty. And so it's a small community, and that's a great way to get to know other people at other burn centers and bounce ideas off of them and make sure that you're thinking about things the right way. And I think the CBRN exam is not just a great way to demonstrate our excellence and proficiency and competence, but I think I'm really hopeful that it's also a great way to kind of bridge these gaps in our community and bring us even closer together.
That makes a lot of sense. And how often are CBRNs going to be recertifying?
That's a good question. I think it's every 3 years.
Every 3 years?
Yeah, every 2 or 3 years. Yeah.
Mm-hmm. Okay.
And there's some professional, some kind of education components that go into that in terms of your continuing education that you can use for that process as well.
Right. And you've been doing burn nursing for quite some time now,
Yeah.
and you now have a PhD. You are a CBRN. You're one of those 500, the first certified burn
Hmm.
nurses. What do you think are kind of like the top characteristics of a really successful, satisfied burn nurse?
I tell people this when we interview them when they're looking for a position here. I think the number one skill, it's a soft skill that you need, is a sense of humor. And I think that's true probably in most areas of critical care, but it is especially true in burn nursing where things can get very dark very quickly. And if you have trouble pulling yourself out of a dark hole, this can feel like an insurmountable dark hole in burn. Sometimes we see truly horrific injuries. Sometimes things that are really breathtakingly horrible to look at. And so if you cannot find, we talk about here at Johns Hopkins, we talk about the joy in medicine and the joy in our practice. If you cannot find a way to find some joy and some levity in what you're doing, it can be a very dark place and it can lead to burnout very quickly. And so one of the things I always tell people when interviewing is how do you wind down? What makes you laugh? Can you find a way through this? Because it can be a hard place. That's true of all nursing, right? But I think in burn nursing in particular, it can be it can be challenging emotionally to see these really disfiguring injuries. And it's really important that you have a way to get yourself out of that. But also I think burn nursing, critical care nursing in general, but burn nursing, I think curiosity. You have to be able to ask good questions. You have to be able to look at a patient and be an investigator and think, they're not healing. Why aren't they healing? What's going on here? And really be a detective. And so I think those two are really the biggest things that I think burn nurses in general need to bring to the table. And those are, your sense of humor gets better over the years. And I think so does your curiosity. When you stop being curious, that's trouble when you're not curious anymore.
Yeah, well, that's great. I think curiosity really, that makes a lot of sense because you do have to be a detective, and there's probably so much to watch and so much to tune into with a burn patient. There's the burn and there's the medications and all that, but then there's the whole psychosocial aspect that you've talked about that sounds incredibly complex and challenging. So you've been at Hopkins since 2012. You now have your PhD, you got your BSN and MSN before that, and you also had a BA in history prior to that. And now you're the patient care and burn program manager at Johns Hopkins Burn Center. And I also know you're on the board and you're the lead nurse planner for the American Burn Association.
Yeah.
You've been a exam content review committee member at BCAN, the Board of Certification for Emergency Nursing. So what do you feel like what's next for you? Is there something more you want to accomplish? Because you're young, you've done so much. Like, what do you feel like could be next for you?
There are a lot of things. The big thing for me is recognition for nurses. And that's why I'm so invested in credentialing and certification. Because I think as a society, although we say that nurses, year after year, we always say that nurses are the most trusted profession, right? But I think that the way that we are portrayed in media is often very troubling to me. I could go on for hours about the way nurses are portrayed in media and the way that, Halloween costumes, that sort of thing drives me nuts. I have, as you mentioned, too many probably degrees. I'm a highly educated and highly trained professional, and most of the people I work with are highly educated, highly trained professionals, and we deserve that same level of respect. So that's really a lot of what I'm looking for. One of the ways that I think that I really hope that in the years going forward, not just here at the Johns Hopkins Burn Center, but around the country, is that I would love to see nurses be able to, and not just nurses, but burn centers and hospitals, be able to kind of take credit, so to speak, for the amount of work that goes into being a burn nurse. So for example, if I'm in doing 6 hours of a dressing change as a nurse, my hospital can't bill for that, right? We can't bill for a 6-hour dressing change because just the nurse is doing it, right? And just the nurse is a phrase that drives me insane.
Yes.
But if a provider is doing a 6-hour dressing, it can be billed for, right? But the nurse has expertise and is able to do really unique things inside their scope of practice that I think we should be able to think about how we can, I don't want to say monetize, but I do want to say recognize.
Yeah.
And I think that that's something that we struggle with as a profession. And that's something that I would like to see change. I would also, the reason I serve on the board of the American Burn Association and the Board of Certification in Emergency Nursing. And I work with the Phoenix Society as well. I think nurses need to have a more public facing role. So I encourage nurses and the nurses I work with to sit on school boards, sit on professional advocacy boards, be out in the public space, forward facing, so that people can see what nurses do. And it's not just what they see in the media. We have to take some accountability for that ourselves and say, no, this is what nurses do. Nurses advocate for public health, and nurses advocate for burn prevention, and nurses advocate for themselves and for their patients and for public safety. So that's kind of where I'd like to go in the future as well.
Well, those are amazing and laudable goals. And I'm so glad you're involved in the Phoenix Society for Burn Survivors. So we'll put a link to that in the show notes too, so people can check out the Phoenix Society. So before we go, I have 4 really quick kind of lightning round questions for all my guests. Are you into it?
I love it.
Yeah?
Yes.
Okay. So of everything there is to understand, and there's a lot, what's something about human nature that you would really like to understand?
Oh, I guess the why. Why do people do the things they do? Yeah.
That's especially when you're coming in contact with people who have histories of trauma and why people make the choices they do. And
exactly.
The people who caused them that trauma in the first place, why did they choose to do those things, right?
Yeah. Why is a big
complex.
question for me. Yeah.
Very complex. And you're a history person, so it makes sense.
The why is always important for me. Yeah.
Yeah. So second question is, who's one of your heroes? Like one of those people who you just always look to, whether they're living, dead, famous, not famous, just someone who's close to your heart?
Gosh, my husband is really an incredible, really just an incredible person all around the reason I'm able to do all these amazing things is because he is an amazing partner and parent, who manages a very challenging career in employment law as well. But in terms of kind of professionally, Flo is always my girl. I always, I keep a copy of her book around. The other kind of person that I go to and that I keep close to my heart is Walt Whitman, who I think most people maybe don't know this about Walt Whitman, who's, famous American poet, but he was also a wound nurse. And yes, he cared for wounds during the Civil War, and he wrote some beautiful poems about what it means to take care of people. And I think that when I have a tough day, sometimes I think about Leaves of Grass, and I think about Walt Whitman and kind of what he wrote about the beauty of and the privilege, because it really is a privilege of taking care of wounds and taking care of people.
Wow. Well, I think you have a book in you. I can feel it.
I don't know.
The history nerd and the nurse, and the PhD, I think I can just feel there's a book coming. So we'll circle back for that interview in a couple years. So speaking of books, is there a book or even a film that means a lot to you? It doesn't have to have changed your life, but just like one of your touchstones.
Yeah. Gosh, there's so many. I read a lot. I wish you could see my office. I read a lot of books. I will say the book that really means the most to me is my family scrapbook. My grandparents were a huge part of my life growing up, and they made a scrapbook for each of their grandkids, which is about the cutest thing you've ever seen. So I have that. And that is so precious to me. When my mom's house burned down, that meant that most of my childhood was also gone too. So I don't have much in the way of mementos and things like from my childhood, but my grandparents had that scrapbook in their house. So that is kind of it's like my baby blanket and pacifier and baby clothes all in one thing. And so that's really important to me. And movies, my gosh, this is super embarrassing, but the Twilight series got me through nursing school.
Whatever it takes, Emily.
I mean, I'm a person who has a lot of noise going on when I'm studying. And so I would always have one of the Twilight movies on in the background when I was studying. And so to this day, if I have a bad day, I'll come home and I'll start cooking dinner and I'll turn a Twilight movie on. And my husband knows, like, ooh, she's got Twilight on. I should probably give her a minute to decompress before I talk to her about what's for dinner. So
there you go. Yeah. Well, whatever it takes. Whatever it takes. Yeah. All right. Last question. If you were named Queen of the World tomorrow and you had ultimate power to do it all, right? What would be your first act as queen to improve the lives of your subjects?
Oh my gosh. I mean, I think basic human needs would be met for every single person. That would be I want food and water and electricity for every single person, and healthcare. That's it.
If you take the bottom of Maslow's hierarchy and add healthcare in there.
Yeah. That's exactly it. Because I see so many people who are missing so many of those basic human needs. It's hard to feel like a human when you don't have what you need. And it's hard to act like a human when you don't have what you need. So that's really, I think you asked about goals going forward. That's kind of my next row is making sure that people have electricity and heating, because that's not a right in this country. And we see a lot of injuries as a result.
Yeah. Well, Emily, this has been so amazing. You are truly a remarkable person. And I can't thank you so much for being here with us. Yeah. And thank you for doing such good work in the world.
Thank you.
It's really moving. So thank you.
Thanks. Thank you so much for having me and letting me talk about this amazing career. And I know that you have stuff in the show notes, but I always encourage people, if anyone has an interest in burn nursing, please reach out. My information is easily available on our webpage, and I'm always happy to talk about burn nursing and always happy to talk with future and current burn nurses. And thank you so much for having me.
Thank you. Thank you so much. Well, there you have it. Thanks for listening to this episode of The Nurse Keith Show. The show notes will be over at nursekeith.com and in the app where you're listening. Please remember Dr. Emily Werthman. She is the Burn Program Coordinator and Interim Patient Care Manager of the Johns Hopkins Burn Center, where she's been a nurse since 2012. You can go to bcen.org/CBRN to learn all about the CBRN certification process. If you need personalized holistic career coaching to elevate your nursing career, check out Nurse Keith Coaching and nursekeith.com. And we are proud members of the Health Podcast Network at healthpodcastnetwork.com. And we are adroitly produced by Rob Johnston of 520R Podcasting. Before we say goodbye, I'll leave you with this quote by the musician Robert Fripp. May my living honor my parents. May my living repay the debt of my existence. Be well, dig deep, seek joy, keep in touch. This is Nurse Keith saying adios till next time from beautiful Santa Fe, New Mexico, and the wonderful, inimitable Dr. Emily Werthman saying arrivederci from
Baltimore.
All right. Thank you, Dr. Emily Werthman. Thanks to everyone for listening, and we'll catch you on the proverbial flip side.